So good afternoon, everybody, and welcome to this roundtable dedicated to COVID-19 and its transnational cultural responses. I'm Marta Arnaldi, and I'm a research fellow at the Queen's College, University of Oxford. It is an immense honor for me to chair this special session of the Languages of COVID-19 conference. And I would like to thank the organizers, Stephen and Piotr, for the impeccable organization, inspirational work, and the caring support throughout the past months. My heartfelt thanks goes also to the outstanding speakers who formed this panel and whom I am delighted to introduce. Timo Obergöker, University of Chester, Kirsten Osten, Rice University, Houston, Texas, and Stephen Wilson himself, Queen's University, Belfast. I feel extremely privileged to be able to participate in this panel too, where I will be presenting my own paper. So in this roundtable, we will discuss the contribution of poetry, music, visual and digital representations, including graphic novels and big data, to our understanding of coronavirus disease. The session, divided into 4 presentations of 15 minutes each, will cover different forms of cultural production across languages, countries, and media. There will be plenty of time for discussion at the end, so you're very welcome, as we have been doing throughout this day, to ask questions by typing them in the chat box. Alternatively, you can ask your questions live by raising digital hands in the Q&A at the end of the talks. So before starting, again, I would like to kindly remind everyone to keep the camera and mic off, and please also, the session will be recorded. So let us begin. The first paper of the roundtable is entitled COVID-19, a Translational Imagination, and I will present it. So I will share my screen now. And where is the slide? So sorry. I hope you're going to see it. Everything went black. Do you see black? Because I see black.
Yeah, it's black.
Okay, I'll end show and try again. Perfect. Here we go. Spiderweb. We walked down a net. The center and the rest were broken. No matter where we looked, you felt the last man on earth. And I, the moon, locked as if I were the cat's eyes, anonymously dwelling in craters. We ran the silver branches from where we scattered words. The spider said last, then first, to weave the distance. During lockdown 2020, which followed the first wave of the coronavirus pandemic, I lived on my own in the house of total strangers. The poems that I'll read today and that will punctuate my discussion were written during those months of isolation. They make up a section of a poetry collection still unpublished, which explores the theme of self-translation. In this talk, I would like to explore the idea that COVID-19 elicited and indeed asked for a series of translational responses, intermediate explorations, interdisciplinary endeavors, and collaborative work. I will investigate this idea by analyzing the links between translation and crisis, translation and futurity, and translation and interdisciplinarity as 3 distinct yet interrelated aspects of what I call a translational imagination. I hope that these preliminary reflections can offer a theoretical voice to the varied and exciting content of this panel. I would like to start by considering three aspects of the translation crisis nexus: communication, vulnerability, and time. These three elements are co-present and interact in any crisis scenario, including the COVID context. Let's think about the first, communication. Understanding a language can sometimes be a matter of life or death. I think, for instance, of safety instructions given on an airplane or of commands given in German in a multilingual concentration camp. On a literal level, translation enables the transfer of vital information among speakers of different languages. As O'Brien and Federici have observed, pandemic crises may have severe implications for temporary or long-term residents with limited proficiency in the language of the country in which they find themselves to live. Together with medically vulnerable people, foreign speakers are fragile too. On a metaphorical level, translation helps us put into words the inexpressible, thus facilitating the epistemic journey from the unknown to the known. If it is true that language is one of the instruments through which we know the world, then we need to have access to and learn how to use this tool. This is all the more important given that situations of crisis, including experiences of risk, pain, and trauma, not only resist the language, but actively destroy it. These are the words of Helen Scarry, who, in her book The Body in Pain, defines the suffering body in terms of the shattering of language. The coronavirus pandemic has proved, if not exacerbated, this condition. And it has also showed us that considerations of this kind can be applied to the case of intralingual communication too. We often do not understand politicians, scientists, and doctors' speech, even though they do not use a foreign tongue. Somewhere near Babel. People think that illness is not essential, that it makes you uglier than that you think you'd be if you were not ill. We all agree with common sense when we have no language. This leads us to the second aspect of the translation crisis link, that is vulnerability. In context of crisis, we tend to adopt selfish behaviors and forget the needs of others for whom the same crisis may even have a more serious impact. As we all know, coronavirus disease has affected vulnerable populations in an extremely acute way. But have translation and translation studies been counted as a possible means of prevention and mitigation of the perhaps avoidable risks to which these populations have been exposed? French philosopher Paul Ricoeur combined his double interest in ethics and translation under the concept of hospitalité langagière, or linguistic hospitality. Language, Ricoeur and others believe, is a refuge. Language, Abu-Dad, is a clinic. People need to understand themselves and each other in order to heal. To put it in legal rather than medical terms, we have the right and the duty to understand one another, as we are responsible for other people's chances of cure. The third element of the translation crisis relation is time. The time of translation is performative. It happens in the here and now. It requires an urgent response which is based on the knowledge of the past, whilst being invested at the same time in the creation of a future. Omi Baba has described the translation's temporal dimension in an evocative way. The borderline work of culture, which for Baba happens in the so-called third space of translation, renews the past, refiguring it as a contingent in-between space that innovates and interrupts the performance of the present. The past present becomes part of the necessity, not the nostalgia of the living. And this was the first quote from Obi Baba's Location of Culture. And I have a second quote. By exploring this third space, we may elude the politics of polarity and emerge as the others of ourselves, end quote. So this quotation illuminates in particular the ethical core of translation, which traditionally and by nature naturally deals with margins. Baba's ethically oriented discourse goes further as he states that minorities, be they migrants, LGBT communities or women, live in a state of crisis or, if one prefers, live in translation. Their fluid identity and migratory bodies form the fluctuant confines of the translation nation, where contagion is a healthy cultural and linguistic contamination rather than the sign of biological aberrance. And I would like to touch upon the relation between translation and futurity. In allowing us to engage with the time-space of the present, translation offers, in fact, the promise of a future. This promise is literary as much as biological. Translation is about the replication and proliferation of texts, as well as of species. It supports the afterlife of words and people. At the same time, however, translating is also a form of memory, a way of conserving and preserving our individuality, something that turns us towards the past, thus asking us to consider and sometimes even return to things as they were. In their seminal study of future and futurity, Adam and Groves shed a light onto this paradox. These scholars notice that our tendency to disconnect the future from the present and the past is a perspective error. We need new visions and new words that can enable us to transform. In this task, I think the humanities and the arts can assist us greatly. Translation in particular is key to the enactment of any perspectival change that may have disciplinary implications. Translation is indeed interdisciplinary by nature. Just like a translation exercise, interdisciplinary research is a change in perspective. Complex, multifactorial situations, such as those with which the coronavirus crisis has presented us, i.e. an impenetrable knot of environmental, racial, and biological issues, these complex situations should mobilize rather than segregate knowledge. I agree with physicist Fritjof Capra as he points out that complexity requires unorthodox, non-linear thinking, one in which even the boundaries between poetry and pathology can be erased. Bearing perspective. Strange words fell upon our illness. A piece of gauze untouched. Sterile idioms covering, then blooming, a passage stirring the dots, 2 nights of meaning. I would like to conclude by evoking some of the ideas explored in this talk. One, that translation is not just or not simply a tool, but rather a form of knowledge. Two, that concepts of health, disease, science, vulnerability, safety, and care are culturally constructed and that as such would benefit from translational treatments. 3, that our relation with alterity, be it another human being, the environment, technology, or a virus, can be affected by a partial, unfair, and/or deviant understanding of translation. The post-pandemic future that we are striving to conquest resembles perhaps the translational present that we are already inhabiting. We cannot and maybe should not colonize the time-space of this crisis. We may be asked to actively and responsibly host and respond to the pandemic of languages. The total strangers I mentioned at the beginning are not strangers any longer. Thank you. So now I'll stop and share my screen. Hopefully this will work. Just a few moments. And I'm now delighted to, thanks everyone for listening. And now I'm delighted to introduce our second speaker, Timo Obergerker from the University of Chester, who will present a paper entitled COVID Pop and Multilingualism. So Timo, over to you. Thank you.
Thank you very much, Marta. Can you all hear me okay? Yeah, okay, good. Thanks for having me this afternoon or this morning for those who are not in Europe. So I'm going to present a few ideas I have developed over the last month whilst eagerly watching YouTube and eagerly watching videos on YouTube related to the recent COVID crisis. So directly after the Corona crisis and the lockdown in March 2020, a wave of different songs spilled over Europe in different countries and in different languages. However, the fundamental message of those songs remained unchanged. Stay at home, bleib zu Hause, geht in tu casa, bleib zu Hause, restez chez vous. All stress the fact that saving lives has never been that easy. It suffices to reduce social contact to a maximum in order to contain this horrid illness. An illness, by the way, which has created new words, like the Flemish knuffelcontact, so the social contact you are allowed to stay with, to hug and to cherish. The French confinement, confinement, lockdown, déconfinement, so the opening up, the de-lockdown, which is, alas, often followed by a reconfinement, so a new lockdown. So in my research over the last month in different languages, I have identified several strategies of multilingualism, of which I would just like to give you a very short overview. The first example I found interesting because it was the first song in French, right, dealing with the entirely new situation of lockdown, is called La Tendresse, which is a remake of an old tune by Bouville from the 1960s, a song then made popular a year after by Marie Laforêt. And a remake of the song was then recorded in March 2020 remotely by a group of musicians, and it was one of the first songs using the technology of softwares like Zoom or Teams we are now uncannily familiar with. In this song, one stanza has been entirely translated from French into Italian and later into Spanish. So, and this was the first actually time I asked myself, why are they doing this? Why do they translate a French song, which in the 60s was entirely in French, into French and Spanish? I might try to give an answer a bit later. Likewise, the French singer Calogero, in his COVID anthem On fait comme si, also a charity song, which was published a few weeks after the first lockdown in France. Actually, this song is entirely sung in French, right? However, in the video, we see how an invisible hand is writing down the lyrics of the song on white sheets. And what happens at several stages is that the lyrics are not written in the French original, but in Italian, which is obviously a reference to the Italian origins of the singer Calogero, but which is also a clear sign of solidarity with Italy, a country which at the time was dreadfully badly hit by the pandemic, and it was the first European country really where the uncanny effects of COVID-19 were to be seen. One can also mention, in terms of like the Italian use, the Italian title of the song Andato Bene by Christovam, a song which is almost entirely in English, apart from a few sound bites in other languages, but which is carrying an Italian title, which I think also is a clear reference to the solidarity really of the Europeans with Italy at a time where, well, every night on the news we were just watching what is going on in Italy well, with a mixture of empathy and the knowledge that this is probably going to cross the border very soon. Another good example of the ways in which texts travel and how multilingualism is used as a strategy in song is the Spanish-speaking tune Resistiré, I Will Resist. And the song was published by a collective of famous Spanish singers during the first lockdown. It's indeed a catchy tune, a remake as well, so we can talk about remakes here, from the Spanish Duo Dinámico from the 1980s. It's a bit like an old Eurovision song, really. It is not a Eurovision song, but it could certainly be an old Eurovision song. If you are interested in cinema, there is one particular scene in Almodóvar's Atame where in a car they put the main characters put in a tape and listen to the song. So Resistiré has very quickly become really the anthem of the coronavirus in the Spanish-speaking world. And it's interesting to see that there was the Spanish version first, but the Spanish version has then has been circulating around the Spanish-speaking world. So there was Resistiré Mexico, but also diverse Latin American countries like the Dominican Republic, Ecuador, Colombia, to mention but a few. Every country, by the way, had their own video clips, which in a way bear witness also to the uneven spread of technological possibilities in the world, as they are of very diverse quality. So it's a good example of how ideas spread from the north to the global south, from Spain to the Spanish-speaking world in times of crisis. It's also a good example of the mechanisms really of cultural transfer. It shows how ideas are adapted in different cultural contexts with local singers who appear to be more apt to express the urgency of the situation. And one can ask oneself the question, why is it that one Spanish-speaking version does not seem to be enough? So it seems as if the song has been translated into Spanishes in a way, diverse forms of Spanish, apt to translate the emotional urgency of the situation. So there are local singers used, traditional instruments used, also local versions of spoken Spanish used. So a fascinating study object really for those who are interested in how a text circulates and travels within the Spanish-speaking world. Resistiré has then been translated into other languages. I have identified 3, but there are certainly more. There is a Swedish version, Vi håller ut, which has been published in May, so a bit later. The Swedish version, interestingly, raises the question in a way of authority of translation, in that Duo Dinámico have, so the Spanish band who have done the original in the 80s, have written to the Swedish team that have recorded the Vi håller ut, and have actually congratulated them for having done the most authentic version of, or the most authentic remake of the Spanish original. I've also identified also something I found absolutely fascinating, a German version called Wir halten Deutsch. However, the German version has been actually confined in a way exclusively to a tiny part of the German-speaking world, and that is Belgium. So the German-speaking counties in the Kingdom of Belgium, not far from the German border, between Aachen, Aix-la-Chapelle, and Liège. So there is a German version which is absolutely unknown to a German public, and which is really confined to this like small part of the German-speaking world. What happened a few months later, almost a year later, and that is also something I think which is it teaches us a lot about how people perceive COVID and how the perceptions of COVID have changed over time. So if we look back at the spring of 2020, there seemed to be a large consensus within our societies that we now have to stay at home. It is the way it is, but staying at home helps to save lives. However, there is a certain part of Western societies which kind of seem to have left this consensus around social distancing measures, around wearing masks, and weirdly enough, this faction which kind of breaks the lockdown consensus came from the cultural scene in France. So there is one song which is really emblematic for how the lockdown consensus is increasingly challenged, and the song is called Danser Encore, which has been written by the Lille-based protest band Imagery, a group which has achieved international fame with their song On lâche rien. I know, or I presume that many of you have been to protestations in France, have been dancing and singing this song. I certainly have. So this band have then done a song called Danser Encore, in which they kind of protest against the fact that especially the French government have decided to close cultural venues, and those cultural venues have been declared in official political rhetoric as non-essential, right? Which in a country profoundly attached to their cultural venues, to their cinemas, to their theatres, to their concert venues, has actually encountered a good deal of resistance. This song again, right, Danser Encore, has then traveled throughout the world and has been translated immediately within the, say, late winter and spring of 2021. So we're talking about a year after the first lockdown here, into a variety of languages. So I have found versions in Italian, I have found versions in Spanish, I have found a French version in the Republic of Ireland, I have found versions in Catalan, there is an English version as well. I don't know how popular the song really was in the English-speaking world. There's one case I find fairly interesting, and that is the fact that there are two translations in Dutch. There is a Flemish version, and there is a Netherlandic version. So the Flemish version actually has, in its translation, been far closer to the French original, and is in a way at the moment becoming like the only authorized version, whilst the Netherlandic version is far closer. It's in its translation far freer, which is, by the way, mentioned on the website, the YouTube side. The Flemish version is called Blijven Dansen, so we keep on dancing. And it is clearly mentioned that the group have actually written this song in toestemming en in samenspraak met de Franse groep Ashkei Zuid-Ambong. So they have written it with the approval and in cooperation with the French group. So here again, the question of authority, right? And the question of authenticity, and the question which is, say, the real good translations are All right, so I know that my time is nearly over. I will conclude a bit, quicker than I thought. So from my point of view, these songs and the ways in which they travel around the world are excellent examples for what can be called localization, in that there seems to be a clear need and a clear desire to have a local version of a song given the emotional urgency of a situation, whilst on the other hand side, there is a very kind of globalized pattern when it comes to performing those songs, which is the flash mob. So if you just go to a place, sing a song without having told anybody beforehand. So I think one keyword really which is important here is localization. Another keyword which I think is important is that it could actually bear witness, but this is obviously maybe a bit early, but an idea I had and a question I've been asking myself. It could open up new alliances and new cultural links, for instance, between Romance cultures and languages in spite of Americanization. So these are just really a few ideas yet to be explored and developed further when it comes to multilingualism and the recent COVID crisis. And thanks for your attention.
Thanks so much, Timo, for this very powerful presentation that took us around Europe and showed us the impact really of non-Anglophone cultural responses, music in this case, to the pandemic. Thanks for raising these important issues of authority, authenticity, and evidence linked to the current crisis. And now I am delighted to welcome our third speaker, Kirsten Oster, Rice University, Houston, Texas. And her paper is entitled The Visual Language of COVID-19. So Kirsten, over to you.
Thank you so much. And I'm going to share my screen now. Let me see here in a moment. Oops. Let's see. And do you see my slide? Yes, okay, great. All right, let me continue then. Okay, thank you so much for the invitation to be part of this conference. It's really been wonderful and fascinating so far. So I'd like to talk about data and data visualization as a kind of central element of the visual language of COVID-19, and specifically the gaps that that framework leaves for our understanding. So the core question that I want to ask here is, how have technologically mediated data shaped the visualization of the pandemic? And I want to touch on a couple of early kind of impulses that I saw frequently throughout news media, one of which, all of which shape the kind of data-driven visualization of the pandemic. One of which was a techno-scientific frame that has been dominant, and in the earliest form looked like the rush to create ventilators, which we saw all over the world as the worry that we would have shortages of ventilators, which would lead to catastrophic consequences. Led to businesses that normally produce other things to start producing ventilators, and kind of do-it-yourself groups trying to figure out how to make low-tech, cheap ventilators that could supplement the shortages. While ventilators certainly were life-saving in many cases, they also ended up not being the salvation for the pandemic that many hoped they would. Another version of the technoscientific frame that I just want to touch on briefly is the microscopic imagery of the virus, which I think really highlights the central preoccupation of contagion imagery with visualizing the invisible. And in the context of the microscopic imagery, this really establishes a technoscientific perspective on the crisis that asserts knowledge, mastery, and control, but also does so with the dependence on sophisticated, expensive machinery. So our ability to even see the virus evinces the successful mobilization of what some have called the biomedical industrial complex. And then, of course, the data visualizations through data dashboards, such as the Johns Hopkins data dashboard, which was certainly ubiquitous in the United States. And there are many versions of this that have been reproduced elsewhere. For example, here is one that is local to where I am in Texas, that's based on the same open source technology. So you can see the aesthetic similarities between this one and this one, because they use basically the same open ArcGIS technology, it's called. So a question that emerges, just touching on those briefly from these as several examples of prevalent ways of seeing the pandemic, is what do we see and what remains invisible from these kinds of representations? I already alluded to the fact that the reliance on ventilators did not end up being the solution to the pandemic that many hoped early on, not only because ventilators don't work without human beings who know how to operate them and are available to do so, but also because it turned out quickly, it became quickly apparent that actually in many cases putting people on ventilators resulted in higher death rates, not lower. Again, some people benefited greatly and it was absolutely life-saving, but it wasn't the technological solution that many hoped. With data, a key question comes in the form of where is the data coming from and who is being counted. So in the United States, this became a conversation quickly about racial disparities and who has access to testing, because of course you can't represent the incidence of the disease without testing people for it. So the missing data that occurs through incomplete testing practices is embedded in these forms of data visualizations. And again, a local example to where I am, this is an image. You don't need to read all of this text, but this is an image from the University of Texas School of Public Health, which has on the right-hand side of the screen about the data. I wanted to include that just to show you all of the many, many caveats that need to be presented by epidemiologists who are trying to communicate the uncertainty and the incompleteness of the data that they actually present, the difficulty of producing data in real time. So in addition, the lagging racial and ethnic data that I already mentioned, that was certainly a very prominent part of the pandemic in the United States, but not only in the United States, of course. One of the key elements here, again, going back to the question of what data visualizations miss, is that for the first several months of the pandemic, racial and ethnic data weren't even being captured when testing data was being produced and disseminated. And similarly, then when Native American populations were having really severe outbreaks early on, they were not being counted at all because they actually did not appear in the forms that were used to count racial and ethnic data. However, it's also the case that although this is a reference to a news story from April 2020, it is still the case to this day that only about half of the case reports that are sent to the central administrative offices that document data on COVID in the United States, only about half of them are actually documenting racial and ethnic data to this day. So that leads to one of the key points that I want to make here about the ways that data visualizations shape our understanding, is that data are always missing, messy, and provisional, and that COVID-19 techno-scientific visual language. So I gave a few examples of that. There are others. That makes it clear that scholars in the humanities must engage with data as a central site of both ambiguity and uncertainty in healthcare. So we cannot take them at face value, which may be stating the obvious to the group that is here today, but I think it bears repeating because the prevalence of data visualizations do not lead to that interpretation as the immediate interpretation that they offer. And so this leads to my core argument here for the talk overall, which is that technologically mediated data, or techno data, produce spectacles of visualization, such as the data dashboards, that erase human narratives of suffering. So in my view, one of the key consequences of the kinds of visualizations that have been very prevalent is that you can't see the human experience of suffering in those representations. And in fact, they are a cleaned up version of that representation by design. So I've done a bunch of research that I'll just touch on briefly here today on digital contact tracing technologies as one kind of site where you can really examine in depth how these gaps in the data occur, and also the kinds of narratives that are produced as a result. I think that these technologies in many ways exemplify the erasure of the human experience in COVID data. And what I want to touch on just briefly about this is that some studies that occurred early on about the ethical dimensions of digital contact tracing versus manual or analog or in-person contact tracing. One of the key contrasts that was noted is that human-to-human contact tracing offers the opportunity to clarify misconceptions, address worries, and express sympathy and other important affects. That is, by one human contact tracer to the person that they may be talking to. Whereas digital contact tracing currently lacks a range of human capabilities and characteristics. In other words, the technological form of communication in this context does not allow for any affective engagement. But more importantly, and this relates to the, well, not more importantly, but equally importantly, and this relates to the technological dimensions of digital contact tracing and the limitations of it. As Ali Al-Khatib wrote last summer, the spaces and the people we should most be concerned for and paying the most attention to won't show up in a digital contact tracing system like any of the ones proposed so far. And he's referencing the digital contact tracing tools created by Google and Apple, but also a number of other tech companies. And he argued we should care that the gaps in our knowledge will be consequential and non-random, sabotaging our efforts to understand what's actually going on in the world and undermining our response. In other words, he's pointing to the fact that the gaps that exist in the data that I was talking about earlier, testing data, are reproduced in digital contact tracing data due to the unequal distribution of not just access to technology, but also surveillance technologies as they are distributed throughout society. And in fact, even a technologist at the MIT Media Lab, Ramesh Raskar, who was also trying to develop a digital contact tracing technology called PathCheck, noted, how do you create a solution that doesn't end up becoming a tool of the surveillance state? That's the biggest challenge for us. So although I haven't gone into the examples of how people respond to contact tracing, there is a very strong theme of feelings of shame, fear, stigma, and mistrust that you see around the world. There are a lot of examples of that from the ways that people responded in South Korea, for example, to the contact tracing efforts there. Again, sympathy and other important affects are something that humans, not technology, can provide. And for these reasons, I really think that the data tracking approach in this pandemic and technology development in response, and more broadly in the health context, is very much in need of humanist intervention. So to recap the argument, the central argument I'm making, that technologically mediated data produce spectacles of visualization that erase human narratives of suffering. I would argue then that what I would call translational humanities at the intersection of data and narrative are needed to address social justice and health equity concerns. And I want to just use the rest of my time to give a few examples of this that come from a project that I've been working on called Translational Humanities for Public Health, which I'll talk about at the very end here. So that project was partly inspired by a data project that was created by an Asian American studies scholar, Russell Young, who started this site, Stop AAPI Hate, to document all of the anti-Asian xenophobic attacks that were happening early on due to the deplorable political rhetoric that was calling the virus the Wuhan virus and all of that stuff. And he was just documenting that as a way of bringing attention of policymakers to what was actually going on. And in fact, that organization has now been acknowledged and received funding from the California State Legislature to continue its work. To me, that's a very different kind of data work that restores narratives in a really important way. The UN called for creative people around the world to develop visual representations that were more rooted in the experiences of the cultural locations that they were located in. And they called for submissions that came from, these are just a few that came from different parts of the world. But here again, I think the contrast with the data dashboard is one that you can see brings a rootedness to documenting what the experience of the pandemic might be like for people in different parts of the world. So I'm just going to move ahead a little bit to a couple closing examples so that I don't go over my time here, but a couple other projects that use data to really highlight the way that it expresses societal values. Projects that look at incidents of COVID in places like prisons, factory farms, and nursing homes. So there's some projects on social vulnerability, COVID-19 and climate, others on COVID behind bars that simply document the experiences of people who are in situations where they are not able to kind of take any control of their own experience of the pandemic and suffer in a different way because of it. How those data appear and are narrated is something that these projects are trying to reframe. And so to go back to the idea of expressing important affects, D'Ignacio and Klein have argued in their book, Data Feminism, and in a piece excerpted from that in Big Data and Society, that valuing emotion as a part of a data science project grounds us back in the world and among the bodies from which data are derived. And this is particularly important if we aspire to undertake responsible data visualization in a health crisis that is having disproportionate impacts on specific populations. So here the connection between affect and different kinds of approaches to data visualization is really central. And to just close with another example, one last example of this, two projects, COVID Black and Data for Black Lives, both of which are data collection projects that are trying to re-narrate the experiences of, in these cases, the Black community, in order to tell the story in a way that is different from how you see it in the data dashboard. So with that, I just want to close by mentioning this project that I've been working on for the past year, Translational Humanities for Public Health. We are using the term translational to build on the definition by the National Institutes of Health in the United States, their Center for Advancing Translational Science. We want to argue that the humanities should be part of the understanding of translational science because they actually are able to offer insights and methods that can improve the human condition and help alleviate suffering in our pandemic response. So we've been collecting examples of projects from all over the world, including from some people who are part of this panel on this site. And if anyone is interested in learning more about that project, you could scan this QR code or go to our website or just get in touch with me later, and I'd be very happy to talk about it further. And thank you very much.
Thanks so much, Kirsten. That was a tremendous contribution, and I would like to thank you for your research, which is crucial to the current times, and not only, and so pertinent to this day, this conference, and for being such a wonderful advocate of translational humanities. And thank you also for showing us that the data, just like translation, do not happen or are not created in a vacuum. So for pointing out the importance of critically interrogate the images, the words that we are surrounded by. So thank you so much for this incredible contribution. And now we move on to the last speakers, last but not least. I have the honor to introduce Stephen Wilson, Queen's University, Belfast, who will talk about Franco-Belgian COVID graphic medicine. So, Stephen, over to you. Thank you.
Thank you very much, Marta, and thank you to everyone on the panel so far for this wonderful discussion on the ways in which culture, broadly defined, has responded to the pandemic. I suppose I want to build on some of the reflections we've had so far, but I want to think about a particular response to the pandemic from France, less so from Belgium today for time reasons. And I want to extend our consideration of visual as a means of responding to the pandemic. And I want to think about COVID graphic novels that have been produced, particularly in the first wave of COVID-19. In his book, Masters of the Ninth Art, Bande Dessinée and Franco-Belgian Identity, which was published by Liverpool University Press in 2005, Matthew Screech analyzes the cultural status of graphic art in France and Belgium. And he notes that this particular medium is not only avidly consumed in France and Belgium, but actually highly esteemed across the social spectrum, from cultural elites to the popular classes. Going right back as far as the Bayeux Tapestry, but indeed beyond that, this rich tradition of combining words and pictures is a distinguishing feature of cultural life in France and its closest neighbour in ways that are not always apparent in the Anglosphere. This was illustrated, in fact, only in the last week in the Times Higher Education, when we saw an article which was entitled, and I quote, "Will graphic novels ever be taken seriously as research outputs?" In the context of attempts to convey individual and collective experiences of COVID-19, and in the spirit of this conference, which invites us to take a more multilingual, multicultural, multimodal approach to considering the pandemic, I want to suggest today that French language graphic novels at least should be taken seriously, because in their harmonious balance between pictures and words, they open up significant representational possibilities when it comes to articulating important aspects of the pandemic. There have been very few literary narratives published to date on COVID-19, though of course it can only be a matter of time before the pandemic novels hit the international bookshelves. But there have been some remarkable comics and graphic novels that have represented lockdown, quarantine, and the experience of suffering from COVID. My focus today then is on France, given its rich cultural heritage of graphic art that has been the subject of important studies over the years by, among others, Anne Miller, Billy Grove, and our keynote speaker today, Charles Forstek. But I would also be interested to know of other cultures, perhaps the Japanese manga tradition or the Latin American context, which is also notable for its graphic art, that have witnessed similar production to that of the COVID bande dessinée in France. In this short talk then, I want to concentrate on two graphic novels published in the first wave of the pandemic. The first one, which is on the right-hand side of the screen, au cœur de la vague, or at the heart of the wave, this word wave that we talked about quite a lot this morning, and then more particularly, La Médecin, or the female doctor, published by Stock. Although some of France's other COVID bande dessinée focus on the psychological and emotional effects of lockdown, or on an almost detective-like hunt for the patient zero of the outbreak in France, the two that I want to devote some attention to today consider the pathological, the medical, and the public health dimensions of COVID-19. The first feature of these texts that I want to highlight is that they are both situated in actual hospitals dealing with COVID. One in the Saint-Antoine Hospital in the center of Paris, and the other just across the Swiss border in Geneva. And both texts, crucially, are informed by sustained dialogue with actual medical specialists. In At the Heart of the Wave, Patrick Chapat, known for his cartoons in French newspapers, presents a graphic journal of his subjective experience of contracting COVID, enhanced by dialogue with epidemiologists and medics, notably Professor Didier Pité, the globally renowned director of the Infection Control Program at the University Hospital of Geneva and the co-inventor of alcohol-based hand gel. The book reads partly like an intimate journal, detailing Chapat's fears and vulnerabilities. Here we see, for instance, the opening page of the text with its use of the sinister black, this target-like design that structures it. And partly it reads like an inquiry into the capacity of medicine and medical care to respond to the pandemic. La Médecin is a collaboration between infectious disease expert Professor Karine Lacombe and graphic designer Fiamma Lucetti, which seeks to explain clearly the pathology of COVID and therapeutic approaches to managing the disease. There is undoubtedly a pedagogical value to this text. It serves a public health purpose in translating scientific messages about disease prevention and control to its readers, notably through the voices of children in the family home. And there's much more I could say about that, but I want to focus instead on an important, though sometimes overlooked, aspect of the pandemic to which these texts draw our collective attention. And that is the effects of COVID on hospital staff. Because what is striking about the French language graphic novels that I've looked at is that they don't so much give voice to patients, as has been the tradition in autopathographical writing that we witnessed over the last 30 years or so in particular. But instead, these texts give expression to those who are behind masks, exhausted, working in contained, sealed-off spaces, but who are nonetheless at the front line of the pandemic. The importance of medics' voices in the COVID linguistic landscape is underlined by Lacombe in both the prologue and the epilogue to La Médecin. In the epilogue, she states that scientific discourse and medical knowledge have been challenged and even undermined during the COVID pandemic like never before by the mainstream media, but especially on social media. And this has resulted, she argues, in the focal point of discussions on the pandemic gravitating from the purely medical sphere into the wider public sphere, where they've lost much of their substance. So La Médecin, then, is an attempt to draw attention back to the epicenter of the response to COVID and to celebrate the commitment and accomplishments of medicine. In order to do that, Lacombe explicitly states that one of the aims of her book is to give voice to medical staff treating patients in hospitals during the first COVID wave. But more particularly, as alluded to in the title and the use of the feminine form in the title of her book, she seeks to give voice to female medics who've been largely absent from press conferences and government summits on COVID in France, and yet have been subjected to sustained misogynistic insults when they have contributed to discussion on disease prevention and management. So here we see her talking to her colleagues in the hospital, and they're congratulating her that she made the front page of Le Monde newspaper And in the same, on the second slide there on the right-hand side, she's talking to her husband at home and saying that once this happened, that she was on the front page, she was subjected to all of these misogynistic commentaries. Lacan is often depicted as using the familiar language of war when discussing COVID with her patients. But what is emphasized by the graphics is that the doctor and patient, as we can see here, are united in the same fight against COVID. The intimate bedside scene, proximity, eye contact, repeated 4 times in this double page alone, reveals the individual care received by patients and the rapport between patient and medic. But the hidden emotional and psychological burden placed on the medic by giving reassurance while feeling less optimistic about the patient's chances of survival is highlighted on the subsequent double page spread when the medic's internal voice is captured. As and we see that in the bottom right here, where she begins to say to herself, she begins to wonder if the patient will make it through, and she begins to wonder if she's not betraying the Hippocratic Oath that she took when she only has the slightest hope that the patient will be cured, and yet she's telling the patient, giving the patient lots of encouraging messages. As the patient's condition deteriorates and the patient is transferred to the hospital's ICU, the graphic novel presents a series of depictions of isolation. The patient on her bed alone, deprived of the company of family or any other person in what is potentially her final hours. The pathos of the scene is captured quite well in this image, in the disembodied voices of the medical team. In this illustration, which is based on the medical trajectory of a real patient who is presented under the pseudonym in the text, the patient's condition does improve eventually, and she makes a steady recovery. Almost 1 month later, Professor Lacan visits the patient in the regular care ward, and I wanted to show this final image from this text, because this image of their encounter not only emphasizes once again the connection between medic and patient, but also I think it's important because in the final picture on this page, the bottom picture, we witness, and indeed we participate through our spectatorship in a reversal of roles, with the patient telling the medic that she looks tired and she should get some rest. Patrick Chapat's text, which links to, though develops the point made in Lacan's graphic novel on the importance of caring for the carer. At the heart of the wave, we are taken on a visual tour of the hospital's COVID wards, and we're told of the working conditions of staff. But this time, the reflections of care given by hospital workers extends to the cleaning team. Pixelated images of whose real faces are incorporated into the text at one point, so that the cartoon image in the middle here is connected to the bodies and identities of real human beings in the reader's mind. And moreover, the work of the cleaning staff is connected to the work of the nurses and doctors in the image in the bottom right here, where we see 34-year-old Ikran entering a COVID ward with the same fear and concerns about protective equipment as the medics that she works alongside. Indeed, it is Ikran who is given the final word in this text, in which she situates COVID within a broader nexus of concerns about care, as Marta did earlier, for the environment, for the planet, but also for each other. And in this way, the text implicitly invites its readers to reflect on the collective duty of care we all owe to those working in hospitals during the pandemic. So much of what we call narrative medicine in recent years, inspired by Rita Sharon's book and her program at Columbia University, so much of this is sought to teach clinical practitioners to engage with narrative, and particularly patient narratives, in order to, and I quote, improve the effectiveness of care by developing the capacity for attention, reflection, representation and affiliation with patients and colleagues, end quote. In parallel with the increasing attention being paid to non-narrative forms in medical humanities scholarship in recent years, the subtle and complex interplay of the visual and the written in representing illness has begun to receive recognition and acclaim from practitioners alike. Known as graphic medicine, this particular form can, as Ian Williams has suggested, convey events that are literally difficult to put into words. This might especially be said to be true of COVID, a disease that can cause severe respiratory, breathing difficulties that is controlled by the wearing of masks over the nose and mouth. But in conclusion, I want to suggest that the French language graphic novels on COVID that I have looked at perform a rather different function. They're not so much concerned, I would suggest, with empowering the patient, with giving him or her a voice in response to the dominance of medicine in the clinical encounter. And nor is there much by way of graphic, still less narrative medicine to be found in them. What they do instead is to give voice and representation to clinical staff who have in particular ways experienced vulnerability, going back to Marta's word, due to COVID. And they draw our attention to the need to extend an ethics of care to carers themselves who respond to the pandemic. For Professor Lacombe, the graphic novel is the ideal medium for translating the experience of medics into this hybrid language of words and images that seizes the attention of the popular conscience. This is my last slide. In an interview with La Croix newspaper published on the 1st of December last year, Lacombe stated, and I'll translate here, "I adore comics or graphic novels. It's a genre that all generations engage with. It allows for a pedagogical message to be conveyed in a light-hearted way while plunging the reader into another world. In graphic novels, we could take the reader to the heart of the action, to the events that lead to decision-making. People only hear hospitals spoken about in figures or statistics or in terms of ICU beds, but you can only understand the reality of medics' everyday lives when you live it from the inside." It's precisely then by bringing us into the sealed off space of the COVID ward and by giving us access to the perspectives of hospital staff that these graphic novels prompt us to think about the concept and the language of care and of patienthood. Because as Linda mentioned this morning in the chat, COVID has had a major impact on doctors. And the French COVID graphic novels I've looked at this afternoon prompt us to think carefully about what it means to be a medic and to be a vulnerable medic working during the pandemic. Thank you very much.
Thank you so much, Stephen. That was absolutely fascinating and so enriching, actually. Thank you so much. There are, as you were talking, I was trying to gather some thoughts to bring into a dialogue the many threads that this panel has suggested, has put forward, and I think there are many. I'll try just to mention some that maybe can be used as a starting point for our discussion. And again, I invite all the participants to ask their question as we start this conversation. So I think that at the center of this panel, very much there is the relationship between culture and suffering. And in the experience of suffering, culture is not just a way to express it. At least this is what I think emerged from these wonderful talks, but it is also a way of perceiving it because we suffer differently. not only according to the language we speak, the languages we speak, or the countries we live in, but also according of the age or the situations, like Kirsten mentioned the experience of some people in prison, or we can think about doctors, particular environments, social, cultural environments. So I think that is very illuminated. It's something we might want to investigate, to explore all the meanings of translation, which is not just an exchange between different languages. And I think that very much at the heart of this exploration of culture and suffering, there were two main themes. Emotions and emotional responses on the one hand, and ethics and ethical commitments on the other. And these two big areas, in a sense, meet in the point, in a sense, if these are two spheres, they crisscross and create a space of interrogation of what is and what means social justice and social vulnerability. And as Stephen wonderfully explained to us, COVID-19 leveled, in a sense, exacerbated but also leveled differences, because doctors all of a sudden became patients, and so this is one of the examples that we can that we should probably take on board when thinking about this experience, which is both so individually striking but also collectively charged. So basically, I would like, to start the discussion, first of all, by inviting the panelists maybe to give some thoughts about the relation between translation and emotions, because I'm aware it's a new, exciting field of scholarship that I think is very relevant to the exploration and understanding of this crisis. And on the other hand, on the ethical implications of these new approaches. So anyone would like to share some thoughts? Thank you.
I could just a small comment about that, and also thank you to all of my co-panelists for your wonderful papers. I really enjoyed them all. So the I showed the slide at the end about the translational science, the definition of translational science that's at the National Institutes of Health in their Center for Advancing Translational Science. And you know, to me, emotion, affect, especially as it intersects with the ways that we interact with technology and technological surveillance systems, both surveillance of disease kind of on that level, and also all of the other kinds of surveillance systems that are more oriented around policing, but also just data collection and those sorts of things. I think that humanities scholars work on emotion as it relates to technology is a really huge missing part of that field of science. And so it's to me a clear contribution that the humanities can bring and should bring, but also it shows the way that, I mean, I'm using translation here in a kind of methodological sense, but also, you know, borrowing from that idea of sort of translating into a kind of applied context, that emotion to me is kind of a paradigmatic example, actually, of why the humanities should be there.
Thank you, Kirsten. Actually, that is wonderful, and it was among the list of questions I would like to ask. Probably I should take advantage of this, because in your talk you mentioned the role the humanities should play when analyzing COVID-19 techno-scientific visual language. And so I would like to, because of the investment and in ambiguity and uncertainty or the way in dealing with ambiguity or uncertainty. So I would like to ask you whether you have some examples maybe from your current research in translational medical humanities or others to show, to explore with us in which ways the humanities practically could help. Thanks.
Well, I mean, so in terms of kind of addressing ambiguity and uncertainty, I think that for me, in a broad sense, this is something that the representation of data, and especially large data sets, is very bad at, and that narratives are very good at. But the problem is that it's very hard to represent, say, 600,000 narratives, which is the number of deaths in the United States so far from COVID, for example, right? Or millions of narratives, right? I mean, it's very hard to kind of synthesize and represent narrative in that way. And it's not really what we turn to narrative for. So to me, this is a question about how to bring those two kind of representational paradigms or epistemologies, right? How to bring them together in some sense. And so a couple of the projects that I showed just at the end, so COVID Black, for example, which is this project by Professor Kim Gallen, it's focusing on telling the stories of people, of Black people in the United States who have died of COVID. And there's a visual dimension to the representation because there are images, there's a photograph of every single person who's on the site. And when you scroll down the site, it just keeps going and going and going because there are a lot. But if you hover over any one image, and so in that kind of collective, I think, is sort of a different way of thinking about data, but it kind of highlights how you can't get a handle on it all at once, but it does represent the scale to a degree. But then if you hover on one of them, then you get a personal narrative that is drawn either from an obituary or from some other kind of documentation about their life, maybe from social media or other things. So it personalizes it and it puts it in a narrative form, which highlights the extent to which they are so much more than that data point, right? So it's to me, that's one example that I think is a really a good way of pointing to that.
Thank you, Kirsten. That's actually a very powerful example of how to, in a sense, problematize the supposed objectivity of science and subjectivity of literature and the way in which this dynamic actually is at work in us as human beings. So thanks you very much. And I would like to ask the other panelists if they had any thoughts to share. Thank you.
Marta, could I just mention, pick up on your point on emotion and vulnerability for a moment. I've been very struck in these texts that I've been considering that we have the experts, the medics, the ones in whom we place our confidence and our trust if we are admitted into hospital with COVID. And yet in these texts published in the first wave of the pandemic, we have these medics who are revealing their vulnerability, who are revealing very openly their fears about dealing with this, about their fears of entering the COVID wards with a lack of PPE, about the fact that at that stage in the pandemic, they did not particularly know how to treat the disease. Obviously, as things moved on and as scientific developments responded to it. There were more treatments that came online, not to say vaccines and all the rest of it. But at that stage, it was a vulnerable moment for everyone. And I think what I quite like about these texts that I've been considering is that you could almost argue that it's quite risky for renowned medics to go revealing their vulnerabilities in this way, revealing their fears. Because, you know, for patients, that you could argue that doesn't necessarily augment our trust in them. And yet, for me, this leveling that you talk about, this fact that the the doctor is sitting at the same level as the patient on the bed, and they both have their masks on, and the doctor is giving sort of encouragement to the patient and everything. There's a very powerful form of care going on there as well. And there's this sense at which they are, you know, and this language of warfare is used. We can have various opinions on the suitability of it and all the rest of it, but they are on the same side. You know, they're fighting this together. And whilst it may be that for the medics that it's you know, it's not a safe pursuit, that there's lots of risk involved in all of this. There's a humanity, I think, that comes across there that's incredibly powerful, and that gives an effect of solidarity, I think, with the reader. So it's different to medical care, but there's another form of care coming across there that I think is very powerful.
Thank you, Stephen. Yes. Following this point, I'm going to pick up the questions in the chat in a minute, but I'm aware I'm also waiting for Timo's response. But just to conclude this discussion, this point you're making, Stephen, there is a question from Jones David in the chat asking whether this way of leveling and experiencing the profession of being a doctor, does this signal a permanent redefinition of the figure of the health professional, do you think?
So, thanks, David, for that. That's a really important question. Alas, I don't have a huge degree of confidence that it will. I think, you know, I think a lot of this corresponds to some of the visual and verbal demonstrations of support and solidarity with medics that we saw during the first wave. Notably, in this country and in many countries across the globe, they're going onto doorsteps and clapping at 8 p.m. to show this national collective solidarity, this very visual and verbal display of support with medics. When it came to the second wave, and they tried to replicate that, it fizzled out. It wasn't very successful. And we're beginning to see again in some of the media, the language, the tone of the language being adopted to represent medical care in response to COVID is beginning to shift once again. My own view, and I suppose I'm not basing it on a huge amount of evidence here, but just from those cultural moments, my own view is that, sadly, I think it's probably more likely that we live through a particular episode, a particular moment there. And sadly, I feel that there's been a shift after that once again. I hope I'm wrong.
Thank you, Stephen. Yes, that's fine.
I suppose I should say at least these texts bring us into the perspective, the mind, the viewpoint of the medics. You know, whatever the bigger response to it, at least they are performing a useful role in doing that.
Yes, thank you very much, Stephen. I would like to ask Timo whether you also had this. Yes.
Just a few points. Thanks for your question, Marcia. Just a few points really, which came to mind when you asked that question. So a thing I found fascinating regarding the country I knew best of all the countries I have mentioned, that is France, that there are languages which seem to have acquired a certain form of like emotional density. And in the first wave, these languages were Spanish and Italian, right? So these like tremendous wave of solidarity throughout Europe has really translated through maybe also remembrance of, say, the common origins of this language. And I was struck by the absence of English, really, in popular culture in France, which, well, given the degree of Americanization, was fairly surprising. The second thing is that, well, apparently language is not just a set of grammar rules. Language is more. So there was not one Spanish version of like the song that existed. There were, I think 10 or so, throughout diverse Latin American countries. So, which clearly shows that in the light of like the urgency, right, there was a clear desire to be able to relate not only to the language, but also to those who perform it, and to the artists performing it. So there seemed to be a particular need of being able to identify with those who produce the tunes. Ethical aspects you mentioned. I have not spoken about one French song, which was called Idemar, which was a collaboration by I think 250 French artists. Again, one of those Zoom videos, right? So it was a song where so all those French artists were expressing their solidarity with the medical staff in French hospitals. And a question I asked myself when I first saw it on TV in terms of ethics was, if all those people who are there on the video, if they paid their taxes in France, and if they didn't move to like London or to the United States, the state of French public hospitals would be far better, right? So there's also a certain extent of like hypocrisy often in the way those songs were used, and they were then kind of used as a means by certain artists to kind of enhance their fame and their notoriety, but it wasn't about, actually about helping. So there was a bittersweet feeling really to those songs as well. I don't know if that makes sense.
Thanks so much, Timo, yes, for this precious insight and that you just given. Thanks so much. And now, because we have in theory 5 more minutes, I would like to ask a few questions, again coming from the participants. There are 2 questions for Kirsten, so I will read them out. So the first one is from Anthony Pim. Is there any country where contact tracing apps have actually worked? Here everything depends on one-on-one narratives. And then there is a second question. I read them together if you don't mind, Kirsten. I liked it is from Marlon. I liked how capaciously you are defining translation in your research, which allows scholars in the humanities to engage in policy-related projects with folks in the sciences and social sciences. I also loved what you said about how data cannot fully reveal human trauma. This is also something that resonates with Beatrice's presentation this morning. I wonder how extensively you're making connections in this project with the BLM and the Stop Asian Hate campaigns we've seen last year. How important is race in the emerging COVID narratives you're getting in this project? Thanks from the University of Michigan.
Thank you. Thank you for both of those questions. So the first one about contact tracing apps. So it depends a lot on what other kinds of surveillance they're used with. So in settings where there is a really strong government-led surveillance system in place, whereby it's not just digital contact tracing, it's also credit card data, surveillance cameras on the streets, lots of other places like that. So South Korea actually is a place where all of that stuff was being collected together. And so in that way, you could say the contact tracing apps themselves they're not sufficient unto themselves. In other places where it was mostly contact tracing apps, like there's an interesting study in the Isle of Wight. They found that it was similarly not effective, and in-person contact tracing was more effective. Like it can help a little bit, but there was no case where, there hasn't been any case so far where digital contact tracing has done the job it's claimed that it could do. To the second question, race has been extremely important in the COVID narratives that we've been getting. I found so far, for example, on the site right now, we have 129 projects, and 52 of them, I think, focus on social justice, most of those on racial and ethnic aspects of social justice, though sometimes that's also crossed with other other sort of intersections of identity. But it's certainly a really, really central part, especially as it relates to the question about data and the gaps in the data and how so many of these projects are looking to recover the stories that are not being told in the kinds of data visualizations that we're seeing so widely. Thank you.
Thanks so much, Kirsten, for these answers. Yes, we have, I think, more of a reflection from Loic in the chat, addressed to Stephen, but I think more broadly also to the other panelists. So the French public grew quite tired of seeing healthcare experts all over the news, which also led to a lack of trust. So again, the question of trust is very much explored today. Now, these same individuals are mise en scène set up in graphic novels. I wonder if we might expect backlash against these productions that do not center patients. Now, doctors are playing the media game, they're performing on TV and on the pages of books. It seems a risky game. And who are the readers to? Yes, thanks for this question, because this is also something I wanted to ask when you were presenting, Stephen, but then you clarified this point towards the end. But yes, the importance of seeing things from the margins, so in a sense from the patient's point of view, rather than from the doctor's point of view. Thank you.
And just to say to Loic, it's a fascinating point. There was a wide readership for these. In fact, the sales figures were quite high, and the authors of these texts were invited on to many of the big radio shows and TV shows. There were quite a few articles written in the press about them as well. But I think I do see where you're coming from in terms of doctors playing the media game, Loic, and the sort of mediatization or celebrity status being given to some of these medical type figures. For instance, Karine Lacombe that I spoke about appeared at press conferences quite regularly with Edouard Philippe, the Prime Minister of France at the time. I think it's significant that much of this cultural production was in the first wave of COVID, when everything was turned upside down and we began to think about things very differently. By the time we got to the second wave of it, it is true that there was a bit more cynicism towards the mediatization of the medics, and I guess that probably explains why I'm not aware of any of these texts that came out during the second wave of the infection.
Thanks so much, Stephen. And I was wondering, Timo, would you have any examples of songs representing the dynamics between doctors and patients, or in a sense, more metaphorically, the dynamic of power involved in this?
I don't have any examples of doctors being present in those songs. The French song I talked about a few minutes ago, Demain, alludes to hospital staff having been on strike for better working conditions just before the COVID crisis. This is also like an ethical question, really. I think we need to raise and we need to be aware of who is speaking and who speaks on behalf of whom. Especially, as Stephen said a few minutes ago, the world was upside down in the first crisis, but these songs are incredibly joyful often, right? So it is about human suffering we are talking here. It's about people dying, people suffering, families suffering, horrid. So I was just asking myself the questions, of the ethical really funding of those songs, and in how far their cheerfulness and say their simplicity does not raise ethical issues. But I haven't heard from any songs where doctors are addressed or are given a voice, but there might be a few. So if you have any ideas, be in touch by all means.
Thanks so much, Timo. Are there any other questions, or also from the panelists, of course? Otherwise, I think I will now conclude, although it's a shame, this lovely conversation, just by making two short points. First, I suppose the need, as Kirsten pointed out, to bring together different epistemologies, different paradigms of knowledge, by means of culture, because in a sense culture includes, encompasses science, humanities, the arts, everything we create, produce, think and respond to and with situation of crisis. Second, the fact that the coronavirus pandemic as a pandemic is a very specific disease which allows us both to explore situation of elitism and of injustice, and in a sense it gives us an opportunity to dismantle useless hierarchies, including the distinction between disciplines, but also between doctors and patients and other power relations that are harmful to the progression of culture and societies. And finally, I would like just to conclude with the title of the song mentioned by Timo, Danser encore. So keep on dancing, so keep on creating, producing culture, because I think Timo mentioned in France, but this happens across all the countries of the world. Cultural venues have been closed as considered not essential. That's what Timo explained to us, and I think actually they are. And these beautiful talks that you shared with us shown us the importance of stories, images, alternative languages, idioms, and way to be both local and global, to be local again, to be embedded in the world we live in, and envisage a more equitable future. So thank you everyone for this contribution, for your contributions. I am very honored to have been here with you. Thank you.
It's such a great pleasure to welcome and introduce Professor Charles Forstek as our keynote speaker at this conference. And Charles will be known to many of you in the audience today. He is the James Barrow Professor of French at the University of Liverpool, and he is a renowned specialist in travel writing, in colonial history, post-colonial literature, and world literature. And until earlier this year, Charles was the AHRC Theme Leadership Fellow for the major Translating Cultures project, which explored how languages, values, beliefs, histories, and narratives can be shared and understood across different cultures and contexts. And indeed, so much of Charles's work is concerned with the importance of translating, interpreting, and multilingualism to the arts and humanities more broadly. And this is reflected in his many publications, from which I would simply single out this afternoon his work on Global France and Global French, as well as two recent co-edited volumes on transnational French studies and post-colonial realms of memory, both with Liverpool University Press. Charles is a firm advocate for modern languages as a translational pursuit in which we translate between disciplines, between societal boundaries, between the academy and practice. And that is why he is the ideal keynote speaker for this conference. And we were delighted, Charles, when you accepted our invitation to be here today. And I think your work is really important for what we're trying to do in this event over the 2 days, because crucially the subtitle of our conference is looking at the implications of all of our work for global healthcare, because this pandemic has highlighted the porosity of national borders and the global humanistic connections between societies and peoples, while at the same time revealing the ways in which the inequalities and how this disease has affected different parts of the world. So your work has so much to say on all of this. It connects with so many of the big agendas that we are trying to pursue in this project and in this conference. And you were the ideal keynote speaker, and we were absolutely delighted that this has worked for you to be here with us this afternoon. And Charles has a slide, a PowerPoint slide to share with us in a moment. And his talk this afternoon is entitled Translating Cultures, Translating COVID. It's over to you.
Stephen, thank you very much. Really kind introduction there. Hello, everybody. We've had a long, tiring and conceptually rich day. And thanks to everyone who's managed to stay to the end. I'm really grateful to Stephen and Piotr, not just for coordinating these 2 days of conferences, but also for putting together this remarkable project. Thank you also to the speakers we've heard already. This is in anticipation also for those we're going to hear tomorrow. An incredible range of papers today, compelling evidence of a real diversity of approaches. And crucially for me, picking up on what Stephen said, evidence of this need for an agile humanities, social sciences response to issues of contemporary global concern. And before I start, thank you also to Jenny for the help with setting us up and keeping us right, and crucially to the interpreting team for the BSL interpreting. Very briefly, what I want to do today is to introduce to you this UK Arts and Humanities Research Council thematic programme to which Stephen has already alluded, Translating Cultures, that I've been working on for a number of years. It ended up being a portfolio of about 120 projects, and it resonates very much with our shared concerns at this event. A number of people at this conference were either funded by the theme or have been involved in the theme in various ways en route. So it's good to be able to reconnect. I'm going to build on that to offer you quite a broad reflection on language sensitive and translational approaches to the current pandemic. And then if I've got time at the end, I'd like to move from some of these more quantitative considerations to the qualitative emphases we've seen in parts of the program today, bridging some of the sessions we've been listening to with some concluding thoughts on cultural production, crucially taking us in the direction of the very first papers today of narrative, literature, and the place of creativity. So I shall now share my slides and begin. Can I just check you can see that?
Yeah, we can.
Brilliant.
Yep, it's perfect.
Thanks a lot. That's great. Thanks, Stephen. So, translating cultures, translating COVID. As I said, this work emerges in part from the thematic program, details of which you can see on the left of that slide. It's also as a result of conversations I've had over the last 18 months in the wake of translating cultures, both with Dr. Marta Arnaldi from Oxford, who we heard in the last session, and Marta's work on translating medicine and translating COVID-19, but also with a third collaborator in our team, Professor Eivind Engebretsen from Oslo, whose work in the translational medical humanities is really inspiring. And some of what I want to say today draws on what are now nearly 18 months of conversations with Marta and Eivind. So in a world increasingly characterized, and we've been talking about this all day, by transnational and globalized connections, this need for understanding connections between, within, and across cultures and languages has, I think, become stronger than ever. Political upheaval triggering the mass movement of people, the proliferation of populisms, the rapid development of digital communications, global health crises of the type that interest us in this conference. They're just some of the interconnected forces that are reconfiguring language and cultures and societies in the 21st century. With a diverse portfolio of projects and a wide variety of outputs and activities, the AHRC Translating Cultures theme during its lifetime between 2012 and 2020 addressed those transformations, grappled with the challenges associated with them by studying, as Stephen said already, the role of translation understood in its broadest terms in the transmission, interpretation, transformation, sharing of a whole range of phenomena, including languages, values, and narratives. Spanning a wide range of disciplinary areas and working across 5 different continents, Translating Cultures projects engaged researchers, but crucially also practitioners and experts in order to interrogate the meanings and uses of translation in contemporary as well as historical contexts. Projects linked up universities, community groups, and NGOs. They permitted contact with industry and healthcare professionals, with the heritage sector and arts organisations, and with government departments. Projects funded under the theme explored the many sites and locations within, across, and between which translation occurs, with particular reference to the role of translation in connecting, in ways I think that really interest us in this conference, the global, regional, national, and crucially local dimensions of cultures and societies. Intersecting directly with other Research Council strategic themes, including, and I think this is really important for our purposes, science in culture, as well as a cross-council programme, Connected Communities. Translating Cultures also situated translation and its various practitioners in historical contexts, foregrounding an interest in understanding the present in relation to the past, but also in connection with the technologies of the future. And over the lifetime of the theme, researchers and their numerous external partners asserted the urgency of translation in many, if not all, areas of public concern. They revealed the ways in which cultures are interconnected and interdependent, reliant on interchange with each other for the delivery of social justice, for creative dynamism, and a range of other mutual benefits. In this paper, I'd like, as I've suggested, to build on the findings of Translating Cultures, to reflect on the challenges of COVID-19 through the lenses that the thematic programme developed. Translating Cultures emphasised the importance for all researchers across the arts and humanities and beyond, the importance of what you all know, that is, the need to factor into all research projects questions of translation and linguistic variability. The work also revealed how not addressing such questions can impact negatively on the outcomes and indeed the broader relevance of research. As our thematic programme evolved, projects addressed challenges and changing circumstances that had not been anticipated when it was set up. As I said, we launched in 2012. Then what happened? Well, Brexit, the election of the 45th President of the United States, a global rise of populism, the crisis of hospitality caused by increased forced migration to Europe. One of the legacies of that work is now to reflect on the implications of the theme's findings for new and emerging situations. And I'm really grateful for the opportunity to continue that work today. That's a sense of the portfolio we had. As I said, about 120 projects in the end. We've also got a number of reports and publications, and if anybody wants PDF copies of those, please feel free just to drop me an email. Now, thinking about building on the theme, I've drawn out a few key findings that I think are really of relevance for our deliberations across these 2 days. They will be of no surprise whatsoever, I think, to the audience, but they're part of this broader work of translating, of communicating our activities to wider audiences within and beyond the Academy. And just to give you a sense of some of these key ideas, core to Translating Cultures was this idea that translation is not just a form of transmission and circulation of ideas, ideologies, forms of knowledge, but it should also be seen as something that is constitutive of cultures and societies in their own right. Building on that, an acknowledgement of multilingualism, the importance of linguistic sensitivity, emerged as hallmarks of functioning, thriving societies. And there was this firm sense that they should be valued as such in order to avoid language indifference or the acceptance of monolingualism as a default position or an unmarked case. Some of our researchers built on that to say, indeed, that language should be understood as a social category in its own right, alongside ethnicity, gender, class, and age, and should be approached intersectionally in relation to those. That notion then led to an emphasis on domestic and transnational policy making and a call for this to be linguistically sensitive, aware of linguistic variability, given the prevalence of bilingualism, linguistic superdiversity in 21st century societies. Associated with that was an interest in access to appropriate translation and interpreting services in both domestic and international contexts as a basic human right, affecting communities' access to a wide range of other services, from education to healthcare. We were also interested in the notion of the expert, and I think we've touched on that at several points today, and this need to rethink the translation expert, not just as academics or policymakers, but also child language brokers, deaf language users, community activists, refugees, as precisely experts on the process of translation at community level. Two final points. One of these will resonate, I think, with at least one of the papers tomorrow. We were very interested in the way in which indigenous knowledge bases are endangered by neglect of processes of translation, and looked at the ways in which epistemicide, that destruction of knowledge, relates not just to what is not translated, but also to choices about what can be or is translated. And a final point, and this links into questions of Anglocentrism that I shall touch on later. Translation is, of course, we all know this, about so much more than decoding the rest of the world for consumption by English speakers. It's a multidirectional, historically inflected process, and a truly translational approach to arts, humanities, and social sciences research acknowledges actively issues of equality, diversity, and inclusion. One of the most significant ways in which translating cultures productively forged interdisciplinary activity across these areas was in the broad area of health and well-being. Dr. Ross White's work, he's a colleague of mine now in Liverpool, has focused on the ways in which psychosocial and psychological interventions developed in high-income countries have been translated for use in low and middle-income countries, and considered whether further adaptation is required for their effective use. As part of a project called Researching Multilingually at Borders, his work focused on the translation of Western concepts of mental health across widely disparate cultures and economies. The project addressed global mental health as an area of study, research, and practice that is principally concerned with addressing inequalities in mental health provision across the globe, something I think that will become really important over the next few years. Something that requires also the concept of translation, both interlingual and intercultural, to be understood in full. Otherwise, though, in the Translating Cultures portfolio, work at the intersection of translation studies and the health humanities was more limited, perhaps, than I'd anticipated a decade ago when we launched this work. But as we've seen at this conference already, the advent of Covid-19 has revealed the extent of what Piotr, in this magnificent book, I hope you all know it, from 2016, dubbed the ubiquitous nature of translation. This underlines the extent to which the translational processes that interest us, often, of course, relating to the interlingual and intralingual transfer of information, but proliferating, as we've seen, far beyond this, have been central to medical, social, political, and cultural responses to the pandemic. To take the example of virology, for instance, It's possible to track the rapid first scientific responses to the disease in linguistic and translational terms. Although the Chinese government has been criticized for delays in announcing the spread of this new strand of the coronavirus in and beyond the city of Wuhan, the response of Chinese scientists was in fact a very rapid one. Already in January 2020, researchers in Shanghai had sequenced and shared details of the initial viral genome on 2 open access sites. In the same month, researchers were able to share first-hand accounts of the epidemiological and clinical characteristics of the disease in major international journals. And as Richard Horton, editor of The Lancet, notes, you can see a piece of his in The Guardian, under immense pressure as the epidemic exploded around them, they took time to write up their findings in a foreign language and seek publication in a medical journal thousands of miles away. Central to this dissemination were therefore acts of translation into English, the dominant language of science, as Michael Gordon reminds us in his brilliant book, Scientific Babel. A study in Nature suggested that by the end of January 2020, at least 54 English language papers on COVID had been published. And an overview of work in that early period written in Chinese draws on the major national databases revealed in China to reveal that by early February 2020, only 23 Chinese language papers had been published on the virus. So there's evidence of an early imbalance, which was a cause of some hostility in China, where dissemination of scientific research in English, not in Chinese, was seen, and there's a cartoon reflecting this here, as a crime even against patriotism, and notably as the reason for the delayed implementation of effective national public health measures in China. Those observations about imbalance were included in more measured terms in a letter to The Lancet around the same time by a group of Chinese scientists who articulated concerns about precisely this unequal distribution of knowledge implicit in this particular vector of translation. They addressed the potential impediments imposed by the language barrier in terms of the frontline application of findings in China itself. They noted it's critical for health science to be published in English language journals to facilitate communication and enable global coordination and timely epidemic response, but then said Chinese researchers within academic organizations concentrated on publishing papers in prestigious international journals, but paid inadequate attention to epidemic prevention and neglected to disseminate their findings within Chinese language journals. So the writers of that letter indicate the need for dissemination in Chinese as well as in English as a solution that allows for both the international circulation of knowledge and its practical application in national, local, epidemiological and clinical situations. They cite, and I think this is really important as we think about the future of academic publishing, they cite the open access sharing in Chinese translation of articles in the Lancet journals as an instance of best practice. So I mentioned these early responses to the dissemination and application of scientific knowledge in the opening phases of the COVID-19 outbreak because they reflect much wider debates with which many of us will be familiar about the languages of science and the importance of translation in the circulation of the findings of research. In a global response to the pandemic, the existence of a lingua franca has proved itself to be central to a rapid reaction. But such scientific monolingualism has implications for the circulation of knowledge, including in terms of impeding those crucial counterflows whereby that knowledge fits the linguistic and cultural communities in which it was initially generated. Translation into and dissemination in English may serve as an efficient means of maximizing the global reach of scientific knowledge. But if this translation and dissemination are limited to that one language, then the localized impact can itself be limited. For this reason, studies of responses to the pandemic in the scientific literature that limit themselves to English language sources significantly underestimate the extent to which the viral proliferation of knowledge needs to be understood in much more linguistically nuanced ways. In the case of COVID-19, though, I think it's important to remember that there doesn't appear to have been a repetition of the situation back in 2004, when research on the cross-species transfer of the H5N1 flu to pigs was discussed initially in Chinese language literature only, reaching an English language audience several months later, when one of its authors presented the findings at an international symposium in Beijing on SARS and bird flu. But the current pandemic has nevertheless witnessed major changes in the dissemination of scientific research, not least in China itself. Significant investment in infrastructure means that the crisis has accelerated, as is the case in so many other areas, reforms of scholarly publishing in the country, and by extension, the sector's international competitiveness. So if you look now, the number of articles on the virus published in Chinese competes with those produced by Chinese scholars in English language journals. What remains clear from the outbreak of COVID-19 is, though, that medical research continues to be generated in multilingual, multinational contexts. The lack of linguistically sensitive approaches to its dissemination not only perpetuates the hegemonies of Anglo-centric, and often I'd add Anglo-normative patterns of knowledge production, but can also seriously limit its local applicability. In that sense, default monolingualism can be seen as a particular impediment to the translation of knowledge. The risk is, and I quote here a collective publishing a medical letter on the CDC and FDA, the risk is that science is not fully meeting its third mission, which is to inform the public, and this means reaching people in their native languages. I think that's why approaches such as those of the Lancet journals, promoting linguistic diversity by ensuring bilingual provision of articles on the virus in both English and Chinese, suggest the beginnings of a growing recognition of the need for post-monolingual understandings, foregrounding the importance of translation in knowledge production and dissemination, and, in WHO terms, bridging the language divide in health. The question of translation as a means of negotiating multilingualism in the area of scientific research is equally apparent, with different emphases in relation to public health. And I think we'll focus on this quite significantly tomorrow. In this area, various practices of ideological monolingualism risk limiting the impact of messaging to communities of speakers of non-majority, often minoritized languages. In a situation, and we've discussed this already today, where the disproportionate impact of COVID-19 across different ethnic groups has become increasingly apparent, there has been acknowledgement of the need to understand multilingualism as a key factor of multi-ethnic societies, and of translating and interpreting as a priority for any equitable public health policy that seeks to negotiate these linguistic and cultural realities. The implications of linguistic diversity reach beyond, however, disease control and prevention. It's clear, for instance, that language barriers, or the monolingual assumptions that often lead to the limited availability of translation and interpreting, can cause the underrepresentation of minority ethnic groups in COVID-19 studies. There's been sustained focus, though, in a wide range of contexts on the need to factor such linguistic considerations into the COVID-19 response, in particular where these considerations relate to vulnerable mobile populations, such as refugees. And these challenges are equally apparent, again, I think we'll talk about this tomorrow, for more static communities, including indigenous ones, where COVID-19 has revealed, not least in the USA, that health services are typically under-resourced with language. Solutions to these challenges have included the community sourcing of translation of COVID-19 related materials, as was the case, to give one example, on a national level with the New Zealand Red Cross, or transnational initiatives of groups such as Translators Without Borders, who responded to the rapid expansion of COVID-19 in a broad range of linguistically diverse countries. The pandemic has also encouraged the development of further initiatives across languages and national entities, in which translation is seen as a means of addressing uneven access to health-related information. So I've been particularly interested in the ways in which guidelines on the impact of the virus on cancer patients have been translated across multiple languages. But I'd add, though, that there's a need in all of this And Anthony and Bay reminded us of this earlier, that we need to factor in those core questions of trust. The pandemic has led to innovation in digital approaches to translation as well. In Africa, the spread of COVID-19 was addressed with a really rapid expansion in health technologies, central to which there have been new functionalities allowing translation of information on symptom checkers, testing centres, emergency contacts. And there's also been real strides in developing COVID-19 messaging in other local languages. At the same time, it's important, of course, not to neglect sign language. In the UK, the differential provision of interpreters at government health briefings brought to the fore frustratingly unresolved issues relating to the rights of those whose hearing is impaired. So in Wales and Scotland, where BSL is a legally protected language, interpreters were employed, but that's not the case in England. Routine mask wearing has, of course, impacted on communication as well for those with hearing loss. Face covering with see-through panels assists those reliant on lip reading and whose language, I'm thinking of cases like ASL, supplements the use of hands with facial expressions. Across all of those initiatives, and I've just talked about a handful there, the privileging of translation has highlighted a broader set of issues relating to accuracy and effectiveness that Rizwan Ahmad summarizes in the first quotation on this slide. Whether it's the challenge of disseminating correct information or dealing with the challenges of misinformation or fake news, multilingualism must be used as a resource to reach out to people in languages they understand and trust. That key word again. These observations lead, though, to questions about the work of translation and the specific responsibility for this. As Ingrid Piller has noted, a key effect of COVID-19 has been the mainstreaming of debates about linguistic diversity. She wrote in this pamphlet last year, in a situation where the well-being of everyone depends on that of everyone else, ensuring equitable access to information, irrespective of whether someone speaks the state language, is in everyone's best interest. Yet at the same time, if translation has become central to the fields of emergency linguistics or disaster linguicism, that responsibility for its provision needs to be addressed quite closely. The UK-based charity Doctors of the World made available state advice on COVID-19 in at least 60 different languages. But at the same time, I've been interested by the way they've cautioned against that very approach, underlining the risks of uneven provision and quality should the responsibility not be accepted by central government and left to local government and non-profit organisations. We come back to those issues of trust. The challenges of providing efficient and effective translations highlight in these ways the crucial intersections of public health policy and language policy. But they prove yet again the ways in which the latter, that is language policy, has often lagged behind the former, public health policy. These calls for language-sensitive approaches to COVID-19 are consequently part of a much broader acknowledgement that translation is central to the design and delivery of public services and information exchange in multilingual societies, areas in which a number of those at this conference, including Anthony Pym, have been working on for so long, and that equitable participation in health, education, economic and legal environments relies on freely available and professional language mediation. The practical role of translation as part of a response to the challenges of multilingualism in the context of COVID-19 is also, I think, a clear reminder of the wider role of the humanities and social sciences in contexts of health crisis. Anthropologist Melissa Leach, reflecting last year on parallels between the outbreak of COVID-19 and that of Ebola in West Africa and the DRC, notes that epidemics are fundamentally social phenomena. This means that, she carries on, whether it's literature, psychology, history, or languages, it's to the humanities and social sciences that we turn to make sense of and escape from the world around us. Now more than ever, we need the insights, stimulation, and comfort they provide. I think it's important to recognize that while a focus on the management of linguistic diversity provides insight into the social dimensions of virology, epidemiology, and public health. Those insights to which Leach refers are multiple, and the role of translation in the therapeutic practices of stimulation and comfort is far from negligible. Translation, then, as practice, concept, metaphor, and paradigm, forms a key part of those translational humanities about which Kirsten spoke so cogently earlier. They're part of this pressing need that has become particularly apparent in the context of COVID-19. In terms of providing these multiple insights, translation is essential. That's true whether it relates to the generation of key information about the pandemic and its control across the world, the sharing of which often depends on complex processes of trans-editing, and many thanks to our colleagues from Leuven for their paper on translation and remediation earlier. Absolutely fascinating, because it's that trans-editing, that remediation, on which the formulation of robust public health policy so often depends. Or whether we're talking about the inclusion of multiple disciplinary perspectives in the formulation of public health emergency measures, a practice which is now adopted regularly by the WHO in the wake of SARS and Ebola. Following the science, with the fetishization of data and evidence that implies, is no longer, we're realizing, an effective or adequate response to global health crises such as COVID-19. Monodisciplinary thinking is increasingly replaced by the very translational practices that underpin interdisciplinary working, as Marta explained earlier. This need for enhanced cross-cultural understanding is reflected also in the strategies adopted to understand and negotiate what it means to be human in the context of a global pandemic. There have been efforts, and we've seen this from the beginning of today's program in session 1, to collect data that records how COVID-19 has been narrated in different languages around the world. And that focus on narrative brings me to the final part of what I want to share with you. And that is looking at another aspect of translating cultures. That's this focus on questions of narrative and literature, and crucially literature in translation. Because this is a bit of a different tack in relation to what I've said already. But over the past year, we've all seen quite clearly that the importance of reading in translation in a context of pandemic has become very apparent. The role of literature and culture in responses to the coronavirus is clear. So the experience of lockdown led to a surge in reading, and in a period of contagion, books fulfill multiple functions. They provide distraction for those on whom immobility and confinement are imposed, permitting on occasion vicarious travel when its physical equivalent is largely prohibited. Literature also plays a bibliotherapeutic function. We talked about this earlier, supporting people through emotional distress, enhancing mental well-being, and complementing other processes of healing. At the same time, plague or pandemic-related literature may, for some, provide a roadmap, ethical, philosophical, even medical, that permits navigation of the social challenges of the coronavirus, often described, we all know, as unprecedented, but clearly, if understood in historical perspective, anything but. In what I'm describing here, the novel seems to have attracted particular attention, as it often focuses on the existential crises faced by those affected and the pragmatic or principled choices that they make. In exploring the emergence of creative writing that negotiates any contemporary contagion, Laura Spinney adopted, I think, a very helpful historical process and noted that little research has been done on the 1918 pandemic in literature and in non-English languages, and in the continents that bore the brunt of the disaster, namely Asia and Africa. The novel wasn't then the pillar of cultural expression it was in Europe or the US. So we know almost nothing about how oral storytellers across Africa dealt with that subject. Now, notwithstanding that lack of attention to the representation of earlier contagious diseases such as, and thank you, Luke, for warning us about these national designations, but such as the Spanish flu outbreak in other language traditions, literature and translation has played a very prominent role in cultural responses to COVID-19. As Beatrice reminded us this morning, we've been invited to retranslate, in the context of the current health crisis, literature we often already know. So what's happened is that a series of texts written in languages other than English, notably, of course, Albert Camus' The Plague and Franz Kafka's Metamorphosis, but other works, including Thomas Mann's Death in Venice, I could go on, have become common vehicles for those seeking to understand how humans respond to health crises, how we make sense of pandemics in terms of their metaphoricity and their practical impact on people's lives. In that sense, literature in translation has illustrated another crucially qualitative dimension of the translational humanities to which I've already alluded, foregrounding historical reflection, critical and ethical inquiry, and crucially, cross-cultural comparison. So, on the one hand, scientists and physicians, inspired in part by the possibilities of narrative medicine, have found in such writing translational potential to explore current clinical concerns. And this echoes, I think, with Stephen's projective comments about the graphic novel. Mullins and Coughlin deploy through their reading of the story of Gregor Samsa in Metamorphosis, the shared feelings of confusion and despair at the heart of what they call a Kafkaesque pandemic. Other scholars have discerned in Camus' The Plague a benchmark for understanding the concept of how our lives and our sorrows become instantly meaningless in the face of an epidemic that spreads rapidly and unexpectedly, inconveniently interrupting our daily routines. So on the one hand, we have that clinical reflection. On the other, as I've suggested already, literature in translation has a more general function, serving as a frame for grappling with societal reactions to contagion, while at the same time assisting attempts to anticipate the longer-term implications of the virus. And to give one example, Robert Zaretsky explores the anxious self-doubt of Camus, the moralist, and concludes, I quote him, "These same doubts, if we wish to hold on to our humanity, should also inhabit us as we in turn resist our own plagues." Now, I've got just over 5 minutes left, and I'm going to conclude with a brief focus on a novel that's attracted much less attention. Nobel Prize winner Jean-Marie Leclésio's La Quarantaine, The Quarantine, a novel from 1995. I mention it because it's not the first time in recent years that Leclésio's novel of contagion and confinement has been deployed as a source of historical parallel and creative elucidation in a context of contemporary pandemic. In a 2006 article, Karim Simpore looks at the broader literary context of the Ebola virus and draws precisely on Leclésio's book to suggest how its author encourages readers to see the study of literary representation as a key element of any pluridisciplinary translational response to health crises. And you can see here, he describes the ways in which Leclésio's characters go through experiences that lead them to question their identity, the meaning of their life, but also, and above all, the scope of humanitarian values. Now, that analysis seems equally pertinent for readings of this text, La Quarantaine, in a context of COVID-19. For Leclésio's novel, at the core of which is the account of two brothers, Léon and Jacques Archambault, unexpectedly confined in the late 19th century on Flat Island off Mauritius as a result of an unexpected smallpox outbreak. That novel resonates in many ways with concerns raised by the current pandemic that we've been discussing so far today. This spontaneous tendency to provide prescribed reading, including works such as Leclésio's La Quarantaine, in the context of COVID-19, has not, and I think this is positive, been accompanied by any prescription as to how we need to read these works. Literature has rather emerged as something that is resonant with our circumstances and the challenges of the present, as opposed to serving as a definitive roadmap for their navigation. As I've noted already, the proliferation of reading lists has served multiple purposes, recognizing that confinement creates a need for distraction, while suggesting also that cultural representations of plague, pandemic, and disease permit reflection on the ethical existential and practical questions raised by this current contagion. So I ask in conclusion, how might texts such as La Quarantaine speak to the present? Well, at the heart of this novel is a tension between mobility and immobility, as the confinement of this island space you can see here, on which much of the narrative is situated, is contrasted with an emphasis evident in much of Leclésio's work on wandering, what he calls errance. In our current context, it's this transnational mobility that's rendered the pandemic global, in terms of the movement of people, but also that of a virus that proliferates, mutates, and reveals the porosity of boundaries and borders. Such hypermobility triggers the immobility evident in confinement and lockdown. But Leclésio notes that any relationship between the mobile and the sessile is not straightforwardly binary. The space of flat island is at once one of introversion and extroversion, simultaneously bounded and limitless. So La Quarantaine describes an interest through processes of what I call microspection into the fractal dimensions of island space that resonates very clearly with our current moment of multiple lockdowns. When other texts of micro-travel, I'm thinking, for example, of Xavier de Maistre's Voyage autour de ma chambre, has acquired a new relevance. So my final paragraph, and then I'll hand over. Unlike his fellow European travellers in La Quarantaine, solipsistically obsessed with escape and the re-establishment of a pre-contagion status quo, Leclésio's protagonist, Léon, turns his space of confinement into one of openness, linked to other languages, to other places, to other histories. The pertinence of Leclésio's novel for our current time is perhaps inscribed most clearly in these divergent responses, introverted and extroverted. While the localized outbreak of smallpox in La Quarantaine is ostensibly very different from the global COVID-19 pandemic, both situations share a concern with reimagining a post-contagion future, what some of us might call the anticipatory humanities. Jacques, Léon's brother, represents what appears to be the majority position among the Western characters in the novel, a desire for those who have survived to return to their former circumstances. In their case, the reassuring social and ethnic stratification of colonial Mauritius. Léon, though, emerges from his experience of quarantine radically changed, seeking instead to learn from confinement and to seek an alternative way of living. The mystery of his disappearance at the end of the novel is a reminder, similar to that implicit in Camus' The Plague, that periods of crisis are not necessarily those of a suspension of normality, but can rather serve as a source of radical re-questioning of the logic of perpetuating any status quo ante. So, on the night before the end of quarantine on Flat Island, Léon, in La Quarantaine, claims tout doit être nouveau. Everything must be new. Emerging from a global pandemic that has revealed major economic, political, and environmental weaknesses, while accentuating ingrained social and, crucially, linguistic inequalities, we're reminded by texts such as La Quarantaine that imagining and renegotiating alternative futures should be more than simply a possibility. And I think that the arts, humanities, and social sciences, through translational humanities, through translational medical humanities, have a key role in ensuring that such imagination and negotiation of possible futures can become a shared priority. Thank you for your patience.
Thank you so much, Charles, for that incredibly wide-ranging and thought-provoking keynote at the end of day one of this conference. There's so much for us to think about in there and to discuss with you in the in sort of 20-25 minutes that we have this afternoon. I'm going to invite people to, if they wish, put comments, questions into the chat at the side, and I'll monitor that as we go along. But you know, if you wish simply to raise your hand and ask a question or put a comment to Charles, feel free to do that if you feel that's easier. We can work that way. I absolutely love this point at the end about reimagining, and the importance of retranslating that you talked about in a literary context. And I suppose it got me wondering a little bit about and speculating a little bit about these COVID novels, which are apparently all on their way. And I sort of wondered, will there, we can only speculate, but will there be something less rich? Will there be less potential in the COVID novel? Precisely because it won't be a reimagining of something that's out there already, a retranslation of something that's out there already. I mean, it sort of brings us back to points that are made about throughout this conference about physical pain, about moral existential suffering. Where do we go to find the words for all of that? We talked about theory today, the theory about how there are no words, these things shatter language, etc. And then we have to go and borrow from contexts that are out there already, more metaphorical contexts that exist already. And so I was just wondering at the end of your talk, what you feel, what knowledge you have potentially about any of these COVID novels that are on their way, and what potential or lack of potential you see in them.
Yeah, Stephen, it's a great question, and it goes back very much to your panel before the break. What really interested me there with Timo's reflections, well, across all the papers really, but with Timo's reflections on popular music, yours on comics, Marta's as well on poetry, Kirsten thinking about visualization, was thinking about form, and once these more mature accounts begin to emerge, and we move from that spontaneous response to a retrospective reaction, what form and what genres are these going to appear in? And our default position, I think, in many cultures we've been conditioned to expect this, is that it'll be novel, or it'll be cinema. But I think what was fascinating about your panel is this sense that there will be this diverse range of forms where we need to be looking, not least thinking about Kirsten's paper, thinking about the possibility of digital responses as well, which give the sort of multidimensionality and possibly the multivocality, which is going to allow the type of response you want. I think picking up on, I'm grateful to you, Stephen, for linking up reimagining with retranslating, because I think you're dead right that to a certain extent this work has been happening by default through various forms of literary criticism. So we're seeing both literal and metaphorical retranslation of canonical plague literature. Camus' The Plague is clearly the most striking example about that, new translation of it about to appear. And what intrigues me in terms of the emergence of these creative narratives is the extent to which they're torn between the draw of the past, as you mentioned, and that weight of intertextuality and the knowledge that we can go back centuries to think about the ways in which societies have grappled with a similar set of existential and pragmatic issues. But also this crucial aspect that I think we've been talking about throughout the conference today of speaking into the present, and what it means to negotiate that intertextuality and to retranslate those texts, either literally or through creative interventions, intertextual interventions, into our specific circumstances. So, we really are, Stephen, in that area, and it's an area I'm often told not to indulge in, of these sort of anticipatory humanities and using our knowledge to reflect on what is to come. But I think in this case, we're already getting a glimpse of what that cultural production might look like. But it throws up precisely those questions you've raised.
Yeah, and I think it brings us back to what Marta was saying earlier about the emotional impact of some of these cultural productions. I can imagine that if you had COVID or long COVID, and you turn to a text which is not on COVID itself, because I think COVID itself would be quite hard to write about. But if you turn to another text that's ostensibly on another subject, which dovetails with some of the effects of COVID on the patient, and suddenly you find there a language that manages to capture what it is that you are going through, then I think there's a moment of identification that happens there. There's a moment of solidarity that happens there, that brings that reduces vulnerability, that establishes connections, connections with other people, connections with other contexts, etc. And I think that's precisely where the therapeutic value of these texts is, in that form of connection, rather than in a novel that writes openly and explicitly about COVID per se.
And Stephen, I know that just to add to what you said, and I was very struck by the conversation earlier, precisely around solidarity and connection, and partly triggered by your paper, thinking about connection between health workers and their patients, and that shared sense of vulnerability. I think what will particularly interest me in terms of emerging cultural production is something which precisely goes from that very immediate local sense of connection to something much broader, and which allows us to think about translation contagion, not just as transnational processes, but global processes in which these connections are often much more difficult to imagine.
Yeah, absolutely. I don't see anything in the chat. Any questions for Charles? You can raise your hand. Hopefully, I'll be able to see it, or you can do a reaction, whatever you want. Okay, so we have. So Loic, thanks you for your talk, and he invites us to reflect on the question of accuracy. In her article, Translating the Pain Experience, Jean Jackson shows that communicating pain should be seen as a translation process, and that patients live out the paradox of wanting to convey the nature of their painful world, while at the same time wanting to produce a distorted translation that, in its very misrepresentation, would alter the experience of that world, rendering it less horrible. Patients also complain that health professionals are imposing meaning upon their experience of pain. With COVID patients, how can translators, the humanities, offer meaning without imposing meaning, and or translate that which is hard to verbalize? It's a very rich quotation, but a very important point. Charles, I don't have any immediate reflections on that.
Well, Loic, it's a brilliant question, and obviously translationally, what you're describing there is working on multiple levels. I've got a very quick answer, but as part of Translating Cultures, we had an associated research network called Translating Pain, and it was run out of Lancaster University. And it might be worth having a look at their network and some of their publications and activities, because they were precisely focusing on the issues you raise, not least this tyranny of the imposition of clinical understandings of pain on sufferers in a way that evacuated their voice from the equation. Not surprisingly, and this goes back to some of our earlier conversations, a lot of that network activity focused around creative writing, and looking at the connections between practitioners, those suffering from pain, creative writers and translators, and also seeing sufferers themselves as creative writers, translating that experience through their work. So I can't give you a full answer on that, but just to say that as part of our broader portfolio, we had a network on that I think would be of interest to you.
Yeah, and presumably questions of form are important there as well, because sometimes these patients, I've seen that project at Lancaster, it's fascinating. Sometimes patients will start drawing to express what it is they're going through, rather than try to find words, because the patients themselves recognize that the words are very often imposed onto their experience as patients. So they reach to things like the McGill questionnaire, which has a series of words prescribed, and you select one when you're in hospital that best correlates to your experience and everything. But I think patients are beginning to, as you say, Charles, react in creative, inventive ways against attempts to impose language on what it is that they're going through. Claudia, I think is the next one. So Claudia, thanks you again for a great keynote. Lovely way to connect literary work from the past plagues experiences to our current times and COVID novels. Unlike the past, current possibilities provided by digitalization and multimodality may help us bridge the literacy and access barriers and level the playing field. Would you like to comment on this?
Yeah, thanks, Claudia. I'll comment on this briefly, and I'll try and keep it brief because I suspect there are people here who know much more about this and have thought much more about this than I have. But as I said in one of my earlier slides, we had this thematic program, Translating Cultures. There was a parallel program called Digital Transformations. And we spent quite a lot of time trying to work at the intersections of those. And as many of you will know much better than I do, I think this is a key area for research, not just in terms of translation technologies, but also in terms of the wider societal and existential impacts of the digital on the way we live our lives. I mentioned in passing the way in which in sub-Saharan Africa in particular, after May of last year, there was a rapid acceleration of the use of digital health technologies. And so there is, when the history of what we are living through is written, I think this will be an area where we see compelling evidence of the pandemic as an accelerator. Now, as we all know, that accelerator process has a dark side as opposed to a positive side. But I think it definitely, Claudia, we're seeing evidence of that across a range of different contexts, domestically in the UK as well. I don't want to go back to the conversation about track and trace earlier, and clearly that there are dimensions about which a clearer post-mortem is needed. But what I would say is that, and maybe this is obvious, but when we're thinking about translation and questions of equality, clearly the digital solution is no panacea, because at the same time, we need to reflect on digital inequalities as well, and particularly between the global north and the majority world, and assumptions around access to digital solutions. We have to be very cautious about those. But as I said, I'm not sure whether this will come up more fully tomorrow, but I think it's a key area, and one that I think is essential to our sort of collective conversations going forward.
Yeah, absolutely. Elizabeth, just to record, she enjoyed your talk very much. Intersectionality and interdisciplinarity between linguistic or translation disciplines and healthcare are becoming an essential and important evolution in translation studies, and then comments that she wishes we were all there in London to discuss this further. Absolutely, I think that's right. We have a question from Yi Tian here. When talking about culture via the lens of language, we need to think that a culture is represented by sharing one language in a nation. While it is important to enlarge the idea from transnational wise to global wise, is it necessary for us to narrow our exploration as well as looking at those culture or subculture groups? In China, for example, there are already gaps that desperately need bridging between different provinces, classes, so on and so forth. And Yiqian says, I would assume that to think about cultural differences within a group that share a same language, and thus to bridge the gap, does not only require an intralingual translation, but more intersemiotic translational effort.
Stephen, can I come in? Because I think from Elisabetta and Yiqian, they're more comments than questions. But if I could just say to Elisabetta, I agree. You know, obviously, I agree entirely, and it was very much underpinning my paper. This sense that a translational medical humanities depends not just on this sort of intersectional, interdisciplinary engagement, but also a recognition of equality across disciplinary areas. That was very much, for very obvious reasons, missing in the early stages of the pandemic. I think the concern is, and I don't want to be parochial about the UK, but we've just had an announcement today that our Prime Minister is going to chair a new scientific body in parallel to our well-established research councils. The big fear is that humanities, arts, humanities, and social sciences, all of which are subject to a global populist assault at the moment, will be factored out of those considerations. And we know from a whole series of previous health crises that is extremely dangerous. So just to endorse that point, but to say that set of assumptions and that particular battle is to adopt the war metaphor. Sorry, is far from one. And yes, exactly, Yiqian. I think it was. I didn't have time to reflect on this more clearly, but I think that, and this comes back to some of the assumptions underpinning public health messaging when they're based around an ideological, not just an ideological monolingualism, which reduces the state to a single language, but also a particular understanding of language, which compartmentalizes and refuses to acknowledge the existence in so many cultures of repertoires of language, or even more so, the phenomenon of translanguaging. And absolutely, this is why I think there's a link between Elisabetta's point and your point. That's where the knowledge from translation studies, from linguistics, from literary and cultural studies can assist with that intracultural complexity, but also those issues around intersemiotic engagement to which you allude. So I agree wholeheartedly, and I think it's precisely that issue which is at the forefront of the types of intervention that a translational medical humanities would permit. So thanks for those two comments.
Thank you very much. I want to ask you about the WHO before we go today, but any other questions or comments before we begin to wrap things up? For Charles, feel free just to raise your hand if it's easier than typing in a long comment. Piotr, go ahead.
Sorry, I just couldn't help myself. I'll be brief. Charles, thanks very much. Fascinating, very thought-provoking. I was just wondering, much of our discussions today about equality and access and justice are based on the assumption that people prefer to speak and be spoken to in their native language in multilingual societies. And that is largely, I think, yes, we have evidence for that, and that's indisputable. I was just wondering, to what extent the opposite could be true sometimes as well. To what extent speaking in a second language, a foreign language, or being spoken in it, sort of framing your experience in a different language gives you a different way of coping with it. This brings to mind Eva Hoffmann's well-known study, Lost in Translation, when she basically says that going through like psychotherapy in English, being a native speaker of Polish, gave her a new way of sort of piecing herself together in a new language. And I realize that it's a complex issue, of course, but I just wanted to ask you to perhaps respond to that in a way that would broaden this discussion even further.
Yeah. No, look, Piotr, I think it's a great point, and two aspects to it. One of which is that clearly we need to engage with work in medical anthropology around the most effective means of communication. And I think you're quite right to question that assumption. And I think we'll be picking up on it tomorrow, and I'm very much looking forward to the conversations, that the default preference is for health communication in a, for want of a better term, native language, not least because so many communities are operating bilingually, multilingually, and that there are issues around the perception of language status and the authority of language. And so that's why I think in terms of, and again, there will be those here who've thought about this much more than I have and indeed researched on it more closely, a linguistic ecology which permits the circulation of public health messaging in multiple languages is so important to pick up precisely what you are describing in pragmatic terms. I also very much like your second point there, moving to the creative, which I think in some ways picks up not just on Loic's point about translating pain and finding the appropriate language in which it can be translated, but also Stephen's broader translational point, and for reminding us that Translating Pain network often was I suppose picking up on Elaine Scarry and others, was post-linguistic, and was focusing on the visual. And I think you're quite right. And in some ways, the response to Stephen's question, when we have one, will help us there, that it's possible that a translingual poetics, the sense of the defamiliarization possible through exophonic writing might indeed, and I see why your two questions are closely linked, the pragmatic and policy linked up to the creative and aesthetic, might possibly provide, there might be new dimensions of translingualism, which will precisely allow those creative approaches across languages. So yeah, that's two really important points, Piotr. I don't know if you want to come back and whether I responded.
No, thanks very much. I mean, I agree. Yeah. If we were all together in London over a glass of something, then we will probably extend this discussion well into the nights. Stephen, I'll hand over to you. Thanks very much, Charles.
Thanks, Piotr. Thank you, Charles, for that. There's so many fascinating points beginning to emerge even at the end of this first day. I wish we had perhaps a third day of this conference, because I think there's going to be so many interesting connections that we begin to make across the different approaches to this topic. I would love to end today by thinking just very briefly about that question of the policy or the pragmatic dimension to all of this, and how we translate some of these thoughts that we've been having into application into the policy arena. And I'd love to know, Charles, what you make of the World Health Organization's coordination of the pandemic to date. There has been, it's made, there've been ostensibly, it's paid lip service to the need for multilingualism, for translation, for inclusivity, and yet it has been criticized as well for relying so much, as you said in your presentation, on English as the lingua franca of science. I wonder because I can imagine that there would be some people who would say that actually it could slow down the response to be working in so many languages. There could be impediments to an efficient rollout of advice and everything. But I wonder what your thoughts are on how a big global organization like the World Health Organization could operate multilingually and efficiently in response to a pandemic like this. What concretely do you think would need to change if you were advising them on that?
It's always good to finish the day with a simple question, Stephen. Look, I share your your sense of this tension between a rhetoric of multilingualism and this bridging of health and linguistic inequalities, and the default position of adopting a certain scientific monolingualism. I think we get into the area, and you've mentioned this already, of the friction related with translation, and the sense that translation across multiple languages not only can slow down responses, but it can also be extremely costly. And I think part of the solution here, and maybe this is too obvious a response, Stephen, but it's this sense of having a linguistically sensitive policy which can take those decisions about every aspect of activity, which takes me back to what I said about translating cultures. This idea, not everybody agreed with it, but this idea that it's important to see language as a social category, which, as with other social variables, is actively factored into to policy decisions within large organizations. So what we get then is an accountability around language, a transparent accountability around language choices, which is based in evidence in the field and in practice. And so that's why targeting WHO is, this happens across supranational organizations, many of which deal with translation interpreting, as we know very well, but not necessarily in this systematic, linguistically sensitive way. And I think that's one of the contributions of the translation of humanities to policymaking, without offering sort of a holistic solution to, in response to your question. It is precisely to ensure that that consideration is there at every level and in every decision. Now, Stephen, that's just the beginning of a response, really. And clearly, the big issue is how does one translate that recommendation into any meaningful practice. Now, there've been sort of, we've tried to do this in the UK in terms of particularly centralized UK policy in having a specialist language advisor operating alongside scientific advisors, and that would precisely be their role to ensure that the questions of language that we've been addressing all day and that have come up in the chat are systematically and I suppose proportionately being addressed, so that those questions around impediments and excessive friction and inevitably resource considerations are taken into account. So that's the beginnings of a response, Stephen, but it's sort of it's a systemic issue across so many large organizations.
Yeah, that's brilliant. Thank you, Charles. Really important points there that you make, backed up by Elisabetta in the chat, who agrees that the key here is approaching language as a social category, as you're saying. I feel we could chat for ages. There's so many things that I'm fascinated by here. But it is 6:30 p.m. in the UK, and it's been a long day for many of us watching our screens and absorbing all of this really interesting information and these insightful approaches that we've been exposed to. So, Charles, thank you so much for this brilliant keynote and for ending the first day on so many compelling observations that you made that will carry us through as a springboard into tomorrow. Tomorrow we begin at 9:30 a.m. UK time, and we look forward to seeing you again, Charles, at the roundtable at the end, where we'll bring everything back together. But a big, massive virtual round of applause to you and to everyone for being here today and for all of your contributions to this first day of the conference. We look forward to seeing everybody back here tomorrow. Thank you very much.
Yeah, thanks everyone.